Thank you, Lisa. Good morning, everyone. Good morning, everyone. Thank you. We got to be awake for all of those folks coming up here to do their pitches. First, I want to say thank you to all of the entrepreneurs and the venture capitalists and potential investors who are here today. And I especially want to say thank you to all the AARP members who have volunteered their time for these 2 days to listen to your pitches and provide feedback on the products and services they hear about. It's going to be, I think, a very exciting 2 days. Everything that we do at AARP is done with one purpose in mind. We want to empower people to choose how they want to live as they age. And in our work and in our actions, we strive to create an America where people have access to care, information, and services they need to lead healthier lives with independence and dignity, and where they have the financial resources and opportunities to match their longer lifespans, and where people 50 and older are seen as an integral part of an inspirational asset to society, not a burden. Or as I like to call it, health, wealth, and self. Today our focus is on health, with a special emphasis on caregiving. Tomorrow it's going to be on wealth, and since all of this is about empowering individuals, the self theme will be weaved throughout both days. To achieve all this and all these goals, we have to really begin to disrupt aging. We have to create a new mindset around aging, a new way of thinking about possible solutions. And in my book, Disrupt Aging, A Bold New Path for Living Your Best Life at Any Age, I try to lay out the framework for how we can go about doing that. But here it is in a nutshell. We need to change the conversation in this country about what it means to grow older. The way people are aging is changing, but many of our attitudes, stereotypes about aging has not. We need to challenge those outdated stereotypes and attitudes and spark new solutions so more people can choose how they want to live and age. Disrupt aging is not about only about changing the conversation. It's about changing the reality of aging, our individual behaviors, our social norms, public-private policies, and private sector practices. It's encompassing changing the culture, how we perceive it, what we believe, and how we behave as individuals, as institutions, and collectively as society. And in the end, it's about finding new solutions and giving people the tools they want and need to remain independent and to choose how they want to live as they age. Make no mistake about it, the way we are aging is changing, and mostly for the better. Consider this. We've added more years to the average life expectancy since 1900 than all of human history up until this time. A child born in 2011 could expect to live 31 years longer than someone born in the 1900s when life expectancy was only 47. Now let me pause here for just a moment to point out that this is a truly remarkable achievement that can be summed up in one word: innovation. Innovation in acute care has reduced death rates among children and young adults, making it possible for people to live productively with conditions that would have killed them a generation earlier. Our medical and healthcare professionals have brought us new procedures, new drugs, new medical devices, and new research that has improved the lives of millions of people. And innovative programs like Medicare and Medicaid have provided access to adequate medical care to older persons, to the poor, and to those who are disadvantaged. We also invested in public health, in sanitation, in hygiene, living conditions, clean air and drinking water, smoking cessation, and improvements in diet and exercise, where innovative solutions have improved the quality of life that we all enjoy today. The result of this innovation is that a 10-year-old child today, maybe it's your son or daughter, grandchild or sibling, that 10-year-old today has a 50% chance of living to 104. And the older he or she gets, the odds continue to rise. Some have even speculated that the first person who will live to be 150 is already alive today. This new longevity is one of the greatest success stories of our time. It's transformational. It's redefining our life course, extending middle age into what used to be called old age, and pushing back and compressing many of the frailties associated with aging into a much older age to give us many more years of active and productive life. In other words, it's changing the way we are living as we age. Yet many of our old stereotypes and attitudes about aging have not changed, nor have the solutions for empowering people to choose how they want to live as they age. That's why we have to disrupt aging, to challenge the old attitudes that ignore the new realities of aging. One of these realities is that more of us live longer. We will need some type of assistance to remain independent in our homes and in our communities. We're quickly coming to realize at AARP that in many cases, people will spend more time and resources caring for their aging parents than they did raising their own children. According to our report in 2015, Caregiving in the U.S., which we did in association with the National Alliance for Caregiving, nearly 40 million Americans in 2014 were providing unpaid care to people who are older, disabled, or in need of assistance. A quarter of them were millennials, and a half were people under the age of 50. By 2020, less than 3 years from now, 117 million Americans are expected to need assistance of some kind, yet the overall number of unpaid caregivers is only expected to reach 45 million, not nearly enough to keep pace with this increased demand. This has serious implications for caregiving. And while anyone at any age can require caregiving, the vast number of people needing care will be those in those older age groups. And the people caring for them will also need help. Family caregivers face unprecedented demands, and those demands continue to grow every day. More and more family caregivers are asked to provide increasingly complex and demanding care for which they have little or no training, such as managing multiple medications, monitoring complex medical equipment, and caring for patient wounds. And as they seek help and solution, they are creating a fast-growing market opportunity totaling over $279 billion from 2016 to 2020, with $60 billion in caregiving out-of-pocket spending. So where do we need the most help? We've identified 6 areas. First, in the daily essentials activities, such as meals, home and personal care, home repair, delivery and transportation services. In the area of health and safety awareness, health vital alerts, diet and nutrition, medication management, personal safety monitoring, and telehealth. We need help with care coordination, care planning, care professional engagements, records and benefits management, and recovery support. In transition support, home retrofit services, long-term care insurance, long-term care provider referrals, legal assistance, hospice care, or funeral planning. We also need help in social well-being, in that digital inclusion, life enrichment and empowerment, community networking and life companions, and last of the 6, in the caregiver quality of life. Respite and backup care, social support, health and wellness, and financial and job security. When we put these caregiving market opportunities in the broader context of overall health and the need to disrupt aging, we come to 3 realizations. We have to embrace this new vision of health that emphasizes well-being. We have to have an integrated approach involving collaborations from all sectors of society, what I like to call the 3 Ps of responsibility. We have to take a personal responsibility. We have to have the private sector engage with us in creating new products and services. And there is a role for the public sector at the national, state, and at local levels. And as more people seek to take control of their own health and fulfill their roles as caregivers, they're looking beyond traditional healthcare systems for solutions. So let me briefly address each one of these. Our healthcare system and our efforts to support family caregivers are out of step with the way people are living today. And our public sector policies and private sector practices have not kept pace with the demands of the caregivers or the changing family dynamics in our nation. A good example of this is the recently proposed American Health Care Act. At a time when our population is aging and people are struggling to find affordable ways to take more control of their own lives, this bill would have made it more difficult and, in fact, would have created barriers that it would have made it virtually impossible. The AHCA would have added an age tax on older Americans, increased their insurance rates dramatically, while at the same time reducing their subsidies to help them pay for their health insurance, and left nearly 24 million people who currently have health care without health care coverage. At the same time, it would have provided tax breaks for $200 billion to insurance companies and drug companies while doing nothing to reduce the overall cost of health care or prescription drugs. And while we recognize that a lot of people voted for change in the last election, this wasn't the kind of change they envisioned. The AHCA was not consistent with what most people want their health care to be. And in order for us to create this new culture of health that puts well-being at the center of our lives, we have to change the mindsets and expectations and behaviors. Our healthcare system is designed to treat ailments, but we need more than that. We need tools that help us prevent disease, improve well-being, and help us to live better than the ailments that we have. And as caregivers, we need tools to help us provide and manage the care we provide to others. We have to help people feel empowered to become an effective partner of the healthcare system instead of a dependent patient. This also means that caregivers, doctors, and other healthcare professionals have to see and treat the whole person, not just the collections of symptoms and ailments. Achieving this new vision of health requires an integrated approach that brings together all facets of society to address the needs of all who need and provide care. This incorporates bringing the diverse interests of individuals who provide and receive care, the private sector organizations, including consumers and nonprofit organizations, businesses large and small, and entrepreneurs and venture capitalists, and the public sector, government at all levels, at the federal, state, and local level. And in order to create an integrated approach that leads to a new vision of health that emphasizes well-being, the 3 Ps must be in alignment, working together towards that same goal. We used to say that the secret to long, healthy life was choosing your parents well. But today we know better. Only about 20% of your health status is due to genetics, and about 20% is due to the health care you receive. The other 60%, the majority that is due to the choices that you make throughout your lives. What we eat, how much, what kind of exercise we do, where we live, the quality of our relationships, whether or not we choose to smoke, our ability to handle stress. We realize today that our health has more to do with the choices we make each day and how we live our lives than it does from the occasional visit to the doctor's office. And as a result, we're seeking more and better ways to take control of our own health. And as consumers, all of us are increasingly interested in questions like, how can I avoid getting sick in the first place? How can I maintain my vitality? How do I maintain my health so I can do the things that I want to do in my life? As caregivers, we want to know, how can I help mom or dad stay healthy? Do they need long-term care insurance? Where can I find reliable and affordable in-home care? And as we're taking more responsibility for our own health and the health of our loved ones, we're seeking more and better information to help us make healthier decisions and the tools to help us adopt lifestyle changes that lead us toward physical and mental fitness and enhance our well-being, not just our ailments. We're looking beyond the healthcare system to this broader longevity economy for answers. And we're looking to you, America's innovators and entrepreneurs, to help us answer these questions. And we are already answering the call, whether it's in the fitness apps and programs, whether it's in medication management, home sensor trackers, consumer diagnostics and care tools, telemedicine, mobility assistant, meal planning, meal delivery, and cooking solutions, or any of the other number of innovative products and services. The technology and innovation you create empowers us to make choices that can make our lives better. Innovation is the engine for disrupting aging, and technology is the driver of that innovation. When we talk about challenging old attitudes and outdated stereotypes, one of the biggest ones is that older people are reluctant to use the new technology. As people age, and many of our members who are here with us today will tell you, they are actually looking for ways technology can help them live and age better. The problem is not age, it's technology that has not been designed to meet their needs. It has to be intuitive and easy to use. Innovation is not just developing new products and services. It's also about how the products are designed and how the services are delivered and the policies are implemented. I'm not talking about designing solutions just for older people. If people today think a product or a service is designed for old persons, neither the young nor the old will buy them. We are most drawn to those innovations that help people of all ages live longer and improve the quality of life for everyone, to really create an ageless product. Innovation is all about creating new solutions and about putting solutions to use. Or as our AARP board member, Joe Coughlin, who's also the founder of the director of the Age Lab up at MIT, likes to say, innovation is about helping people do things. It's our experience that people deal with issues related to health, wealth, and self all at once. They don't live their lives in silos, nor do they want solutions that do that. They're thinking about their futures, where they're going to live, how they're going to get around, how they're going to stay connected to their friends and their family, how they're going to get health care and long-term care if they need it and when they need it, how they're going to make their money last, or how they're going to live a longer life the best way possible, or in other words, how are they going to do things? The challenge to all of us is to take advantage of the information, the research and knowledge we have about living and aging well, to create not just products and services people need, but ones that they want, ones that they see will help them live well each and every day, whether they need care or they're the ones who's providing the care. People 50 and over are responsible for over $7.6 trillion in annual economic activity. They represent a largely untapped market opportunity for entrepreneurs, investors, and the private sector. I know you know that, or you wouldn't be here. So I applaud you for taking on this challenge, and I hope you will continue to disrupt aging and to focus your work in helping yourselves and others to live their lives every day. Thank you, and congratulations to all of the folks who will be presenting here today. Shall we go over here?
That was great. Thank you so much. Now I have to say, the term disrupt aging used to mean you murdered people, right? So that's an interesting term. How did you come to that term?
So I came to it because when I came into the role as CEO of AARP, I was having a conversation getting ready for one of our big member events, and the co-author of the book, Bo Workman, had drafted me to give my first speech, and it was about prepare to get old. This is all the things you need to deal with. And I read the speech, and the staff knows that I'm one of those 24/7 email readers, and I respond back, and I didn't respond in a couple of days. And Bo came to the office and said, so you didn't like the speech, huh? And I said, well, I don't feel like that at all. I don't feel like I'm old. I don't feel like I'm on this downward spiral, and I don't think that most people out there feel that way. I actually think we need to disrupt this whole thing of aging and talk about aging in a very different way. And so that's how the Disrupt Aging title came about.
So there's this great quote I saw. Charles Schultz said, when you're over the hill, you pick up speed.
Yes.
So I like that. So your cohort of customers, people over 50 now living to 100, that's a pretty big span of life, right? So that's a lot of people. How do entrepreneurs think about that? Because one of the challenges I've seen in this marketplace is it's not a market. It's a lot of people.
Yeah. Well, I think that we as society are going to have to think about the 100-year life and really rethink that whole experience of, how we educate ourselves. Do we really need to graduate from high school and go to college right away and do those 4 years and then go right into the workplace? Or this idea that if you're going to work 50 or 60 years, can you spread out not only that educational experience, but also that debt over the course of the lifetime? How will we have to rethink our interpersonal relationships of marriage and dating? I often say when I give one of my speeches, particularly if it's an audience of women, if you knew your husband was going to live to be 100, would you have done anything any different in the first place?
My husband's here, so I'm not going to answer that question.
But really thinking through what that life looks like, and particularly in this area of work, it used to be you wanted to go somewhere and work for a good company and stay 25, 30 years and retire.
Right.
And now most people are not only going to have 5 or 6 or 7 different jobs, they're going to have 3 or 4 totally different careers.
Yeah.
And so how do you spread that out over a lifetime? And I know for our members at AARP, a large percentage of them are telling us they don't want to retire. They may need a break or what used to be that sabbatical year that you took off. How do we rethink that 100-year life so you take 1 or 2 sabbatical years throughout the course of your 100 years to refresh, to rethink, to really move back in the marketplace? And so I think that as we design products and services that are ageless, it's going to create an increased market opportunity for companies and entrepreneurs out there to really design products and services that people will use throughout a lifetime.
So I've heard you speak about the new middle age.
Yeah.
And so my question is, do I need to buy another sports car, or am I good with the one? That's my first question. And so what, but in the construct you're talking about, we've often thought about it, or we always think about it, I think it's early, middle, and old, right? Early age, middle age, and old age. That doesn't seem to fit anymore in the way you're describing. Do we need different categories?
We do need different categories, and yet I don't know what the name of it is yet, but I have sort of thrown out this, what if we said middle age started at 65? How would that change
I'd feel better.
the way I feel great. How would that change the way we limit ourselves in what we're going to do? And also to, because at 65, people are then beginning to retire, they're enjoying their Social Security, they become Medicare eligible. But what we're seeing now is people really, either because they have to or because they want to, are staying in the workplace well into their 60s and 70s.
Right.
And so if you thought middle age was 50, and now somehow you pick up another 15, 20 years of life at the end, what we want to do is to not just have people tack 15 years at the end of their life and do whatever they're doing there, but how do you spread out that activity and really think in a very creative way of what it is you're going to be doing in that lifespan.
So if I'm going to live to be 100, what is the single thing I can do for myself that's most important besides, figuring out how to defy gravity?
I would, I still go back to health, wealth, and self. I can't say it's
That's
one.
three, though.
I know, but you want me to pick one. I want all three. But it really is about how do you keep yourself healthy and physically fit and start that so that you can stay in the workplace, so that you can do all the things you want to do. Because the worst thing that could happen is you're living to be 100 and you're living in ill health for 20 or 30 years.
Yeah, no kidding. So in your view, I mean, you see so much across those three categories every day. What is the thing that's getting the least attention that needs the most attention? What is the underserved issue in your realm?
Well, I think drawing, people seeing how all those fit together. So 2 weeks ago, we were having the conversation in Washington, as I alluded to, around this new health care bill.
I heard about that.
But the implications of that on Medicare and on Medicaid, how tax reform ties into Social Security and that financial security net. These programs were put in place some 80 years ago.
When people lived to 63.
When people worked or retired at 62 and died when they were 67. And so the idea that now you're going to live to be 100 and that Social Security system was put in place assuming you were going to die at 67 or 68,
right.
We have to rethink all of those programs and health care and Medicare and Medicaid and Social Security, and the idea that the majority of the private sector don't offer pensions for their employees, or the idea that we have to get individuals to start taking responsibility to save earlier so that they don't outlive their financial resources. So all of those, I think that's the one thing that we try to clearly bring across to our members, to say all of these small actions taking place at the national level and at your state level and in your local level all have implications for how you're going to be able to live your life.
That's so interesting, that because it really begs the question of teaching people when they're young, right, to start saving when they're 21 or 22 or whatever, to start taking care of their health when they're young. That's not your audience. How do you get that message across so when you inherit people at 50 to AARP, they're in good shape?
Well, I think it's not just for us to do, it's as society,
sure.
We need to be doing this, and not just in this country. There are 32 other countries in the world who have older populations than we have. And 10,000 people a day are turning age 65, and that's going to happen every day for the next 14 years.
Just in the U.S.
Just in the U.S. And so we have to really teach from a very young age how important it is to eat healthy and exercise and save, regardless of how small it is, that over time, that will surely put you in a better position than if you waited till you were 65 and assumed that Social Security was going to be there, or Medicare and Medicaid.
So we as a nation have separated the conversations about health and wealth completely from each other.
Yes.
How do you work to bring that dialogue together for people, or change the paradigm so it's not, because they're intrinsically tied, right? If you're old and unhealthy, you're probably going to go bankrupt as a result of it. So what do you do to reconnect those concepts for people when they're still young enough to make a difference in their lives?
Well, I think what we're trying to do, certainly with our conversation around disrupt aging, and not just to our members, but to our members and their families, of how do we start changing this. Even the conversation we're having here of really bringing in these young entrepreneurs and innovators, of how do you create ageless products and services that everyone will buy. I often use the example of, why don't we build a house from day one that's going to allow you to live and age in your house, rather than assuming that once you reach an age when you might start having some mobility issues, that you physically have to leave the place you love to go into another facility or nursing home or some other care facility, rather than designing entryways and bathrooms and all of those kind of things that are ageless, that is just as helpful to a young mother with a stroller as it is to someone who might need wheelchair assistance. I usually give the example that out here in California, one of our biggest partners when we were working to get the sidewalks adapted, so access for wheelchairs and disability, that our big partner in that was mothers with young kids in strollers, that curvature in the sidewalk was just as important for that young mother or someone going to the grocery store who needed to carry that grocery cart as it was for someone who might need some kind of wheelchair or disability assistance.
I think we're going to need to come up with a system for keeping the cats from running up and down the stairs when you walk up and down them as well.
Or get rid of the stairs.
Yeah, get rid of the stairs, or the cats, I guess. When you...
PETA's going to come after you.
Yeah, well, you're going to have to stand in line. When you think about caregiving, I mean, when you guys talk about caregiving at AARP, you have a very broad construct for that. You know, I think most people, I'm guessing, think of that as a person taking care of a person. But you think of that as a very broad set of issues, which we are representing here today with a very broad set of companies doing different things. What do you think of when you think about caregiving? What does that mean to you?
Well, I think, as I said just a little earlier, the most shocking thing is that we're going to actually spend more time caring for an older person, whether it be a parent or a spouse, than we did raising our own kids. And so if you're living to be 100, you may be in that caregiving situation for some 20 or 30 years, depending on that person's individual health. And so the role that we've been trying to play at AARP, because this is the one nonpartisan, bipartisan issue on the Hill, that if you go up and talk to members of Congress, whether in the House or in the Senate, every one of them has a caregiving story.
Probably for themselves, because most of them are getting
for themselves. Exactly. Well,
sorry,
you're going to get in so much trouble. But for us at AARP, it's been really, how do we care for the caregiver? Because that is there is such a shortage of people providing care in this country, and that need is not going to decrease. It's actually getting bigger. And so how do we think about, I just lost my father 2 weeks ago.
So sorry.
And one of the biggest issues that he was in Alabama and my sister and I were up on the East Coast, and how do we coordinate that care, making sure that he had access to what he needed in his home or wherever he was getting that service, and how difficult it can be because there is also an issue of elder abuse, which is more likely to come from a family member. And so how do you address and put in places laws and policies that really protect the patient, but also provide the right level of service and access so that you can have those medical conversations with healthcare providers, or you can be able to speak to that local pharmacist and really talking about something we're going to deal with tomorrow on the financial side. The first person who usually sees the decline in the healthcare or the caregiving is a financial institution, as individuals are going either double paying bills or not paying bills, or all of a sudden writing a whole host of checks. And so how do we bring that caregiving, thinking about what we call 50-plus banking, into the financial industry, and also individuals and family members to take that into consideration as they're putting in place their banking needs.
Yeah, that's a really interesting challenge, I think, that whole financial side, because I think, you know, especially for couples when one dies, right, and the older families, and the wife or the husband has been the one writing the checks all those years, and you know, leaves the other without really a way of knowing how to run the household. I think it's an interesting challenge, and I think most caregivers that I've thought about, at least for me, are really focused on the health side or the functions of daily living, and not sort of the financial management and all of that. Are there programs that you guys provide or seeing that will provide that level of resource to people?
Well, we certainly have a whole a caregiving.org website at AARP/caregiving that provides a wealth of information and really points people in the right direction of where to get service at the local level. And I think that it's one of the best resources that we have in the country to do that. But this is an area that is constantly changing, and we need to continuously update our thinking about the care that people will need, and so that they have just-in-time services. And the people providing the care, how do we provide them with stress release tools and services so that they can be the right level and kind of caregiver. You know, the majority of those caregivers are women, more than 50%. They're also the first ones who've probably taken themselves out of the workplace to have kids, and now they're taking themselves out of the workplace to provide care, which affects their pension and their payout for Social Security in the long run. And so how do we also start to address those kinds of issues, and whether or not companies will factor in, just like we do for giving birth, how do we start factoring in the caregiving aspect? One of the things that we did this year at AARP is to give all of our staff up to 2 weeks of paid leave to do caregiving for a family member.
Wow.
And it has proven a great benefit from our staff, even if they didn't have to use it, to know that they worked for an organization that felt it was strong enough, felt enough about them that they could take that time off to care for that loved one.
Well, I think that's really putting your money where your mouth is. That's a really cool thing. Have you seen other companies do that?
We've seen other local governments trying to get that through, but I'm not sure I know of any others that are doing it actually, that's not counted towards your annual leave or your sick leave. It is a specific 2 weeks devoted to family caregiving.
I've seen companies where other people can contribute their vacation to you.
Yes.
But I haven't seen that. That's a very cool idea. Is it okay if I ask you a question related to your dad?
Sure.
So it's always interesting for me, like as a healthcare person, I've spent all 30 years in healthcare, and then when I was a patient for a serious thing, I had a whole new appreciation of some of the issues I'd talked about for a long time. Did you find that when you were taking care of your dad, did you have a new appreciation for some of the issues, or learn something different about what you talk about every day that informs what you do?
I have to say the biggest learning experience was in consultation with his doctor, he had decided to change his health care plan. And in this last 6 months or so, it wasn't adequate. So we're working with them. My sister and I were actually paying the course of the health insurance premiums for him. And then when we came down and said, well, what do you mean you changed it? He says, oh, the doctor said I wasn't going to need that, which triggered a whole new conversation and excess bills. And in going through and working with the AARP staff, to just see how complicated it is to decide what health care plan is right for you, how Medicare works, how do you go through that. And I came back to the staff to say, if I'm having difficulty understanding how complicated this is, I know that the average person out there we need to figure out how we can simplify how these programs work, who has access to what your rights are as patients to be able to do that. Yeah. And to me, that was a real eye-opening experience because I hadn't had to deal with it directly for myself. So I call it like those MBA students who think they know how to run a business, and then when they actually come into the business world, it's very different. So
I've never seen that.
Really?
That's so interesting.
But just talking about why we need Medicare and Medicaid and how it works, and then actually having to go through and seeing how difficult it is for individuals to get information, and how important it is to have all your legal documents in place. So whoever that person is, whether it's your child or spouse or some other person who has the authority to speak for you, so important that we all have that, not just when you're older. Now, you need to have that in place now that decisions can be made. Yeah,
I don't know if some of you haven't seen, there's a thing called the 5 questions that Alex Strain has put out on the web over the years and talked about in her Unmentionals program, and it's about those end-of-life questions and preparing for that when you're young enough to decide what you want for yourself. I'd encourage you to go find that. It's really a worthwhile thing, and my husband and I have just gone through that, and it's been an interesting discussion. You have to decide what your siblings you like, and it's always hard to prioritize them. I have lots of them. So in your book, Disrupt Aging, you talk about the importance of a variety of factors for making better lives for people over 50. There's individual behaviors, there's social norms, public policies, private sector practices like we just talked about. Is one more important than the other? I know you're going to say they all have to work together, and I'm sure that's correct. But what has to happen first? You know, what is the domino that has to happen for this to go right in the end?
I think it's really about people taking personal responsibility for themselves, and that you as an individual recognizing what you have to change. I know since I wrote the book, I'm trying to live healthier than I probably had been before we were sort of putting down all these things and seeing how small changes really do have a lasting impact, whether it's walking, whether it's, eating more fruits and vegetables and getting healthier. And I think
I really liked that bacon wrapped steak last night at the party though. That was good.
If in fact you're engaged, either working or volunteering, eating healthier, you're likely to live 6 to 7 years longer than someone who doesn't.
Yeah.
So, you have to think about that. I'm not saying it's easy by any stretch of the imagination, but for me, it's starting with you as an individual, taking personal responsibility around your health, around your finances, and around that personal fulfillment space, because as I said, we know people who are personally fulfilled or feel like they have a purpose or meaning in life, live 6 to 7 years longer than someone who doesn't.
Yeah, I mean, I think that's such an interesting topic, the whole issue of purpose, and also I think what's connected to it is loneliness.
Yes.
And I think we're just starting to talk about that as a social determinant of health.
Well, and in the work that we do in AARP Foundation, which is solely focused on helping what we call low-income vulnerable, the issue of isolation and its impact on one's physical and mental state, 2 or 3 times more likely if you're isolated to have a heart attack, diabetes, high blood pressure, less likely to have a full-time job or somewhere that they physically can go to. And all those things have repercussions on how you live and being isolated. And so while even as we come up with solutions that connect people with technology, we know that it is more important to have a human connection, that the technology can move an individual almost, just so far, but having that interaction, and particularly in the low-income area, low-income vulnerable space, we know that for many people, the postman or the Meals on Wheels person is the only person they engage with on a weekly basis.
So loneliness, one of the biggest determinants of health. So everybody should hug their neighbor. Now, that would be good. Make a friend, because I think we're going to hear a lot more about this. It's an interesting topic that bears more scientific scrutiny and more attention, because I think a lot, and I know some of the companies today are actually addressing that issue very directly, because I think that is a low-cost medical solution, right?
Absolutely.
Is to give people contact with other humans. Yeah, very interesting. So what are you seeing in today's world, our world in the U.S., that worries you, that gives you pause on these issues?
There's so much.
Discuss.
I think this, as I said, I think that I try not to, while AARP is focused on the 50 plus because that's tied to our non-profit status, that age of 50 and older, I really do think that we need to focus and look at people not by age segments, but how they're living their lives at a particular point. And going back to our earlier conversation, the implications for changes in healthcare policy and in tax reform and all of those things have such serious implications for how we're going to be able to live our daily lives. And so I think that's something that we really need to pay close attention to. I was doing an interview the other day, and I said, we have 38 million members, and 82% of our members voted in the last election. So we know that this is a very engaged group of people. Yeah, that's clap. That's a good, good thing. So we're trying to make sure that our members, whatever however they vote, that they get out there and vote and they voice their opinions about the change that they want to see here in the U.S. And so, looking at what's going on in the business community, as well as, how we're going to have to adapt our communities and our neighborhoods with transportation and services. I also heard the other day that one of the key things that people who are over the age of 50 are looking for is this voice technology. So even if they can use a device, and I will say that most people over the age of 50 have at least 3 technological devices. So it is untrue that they don't use technology. But the idea of how do you make it and design it in a way that makes it easier for them to use, like with voice activation, or not using the gray shaded backgrounds, which makes it harder to see. But how do we start looking at all of those things that so that it becomes ageless, and that we are really envisioning the future of how we want to, and I say it purposely, live and age, not live to age, but living at the same time while you're aging, because we start aging the day we're born. And how do we take that negative connotation out of when you turn 70?
We got to change the word.
Exactly.
We need another word instead of aging, right?
Instead of, okay.
Ripening or
ripening.
Something. Right.
I use the word experienced, that 50 plus individuals bring enormous experience to the workplace or to whatever it is they're doing, whether it's volunteering or in life. How do we couple that? I think one of the interesting phenomenons we're going to have to address is today we have, in most places, 4 generations of workers in the workplace at the same time, and could very well soon see 5 generations. At AARP, again, we're trying to model that. So we have teams of 4 generations working on projects together to talk about how do you come up with better solutions and new experiences that they bring to the workplace. And I've also seen many private sector companies actually professionalize the mentor relationship and actually have people, more experienced workers, being formally put in a mentoring role. So that's their full-time job, to serve as business mentors within their organizations, to be able to go through and do that. And so teaming those multiple generations in the workplace at one time, I think is going to is proving to be some of the things that's going to turn around a bigger return on investment and also produce better outcomes.
A whole different level of childcare.
Absolutely, on both ends.
So this is your first time at LivePitch, I think.
It is.
Which is exciting. What drew you here today specifically, and what is the definition of success for you these next 2 days?
So let me start by saying that I am a huge supporter of organizations who continue to transform themselves, and I think that's what we're trying to do at AARP. And so since I've been there over the last 7 years, and then as the CEO since 2014, have really tried to embed in everything that we're doing that innovation is a part of our everyday work at all levels in the organization. And we stood up our innovation lab last year, and Jody, as you said earlier, has been putting on the LivePitch for the last 6 years, and really trying to stay engaged with the entrepreneurial community about bringing the issues that we need solutions for, and for AARP to be a partner at the table, not only in bringing our consumers to the table to say this works or it doesn't work, but also really coming up with products and services that they need to live their best lives. And so it's exciting for us at AARP to be in this space. I've watched the LivePitch from webcam from afar, but this is my first time here.
It must make me look
so
even
I'm
shorter.
Excited to see the 3-minute pitches and the creative solutions, and then figure out how they're going to decide where they're going to put their money, and the kinds of, and also to hear from our AARP members what it is they think, and what they're going to see here is really going to help them as they try to navigate these challenges and opportunities.
That's one of the things I love most about this event, is that you bring in AARP members who aren't professional investors, who aren't here for their job, they're here for their life and experience to give their input. And what has been fascinating is I think there's only been 1 year, so at the end we have the audience members and then the investors separately vote on their favorite concept, their favorite company. And I think there's only been 1 year where they pick the same winner, the two groups. And I think that's fascinating. Now, recognizing investors are looking for something they think is going to create a financial return on investment first, by and large. But actually, they should be listening.
Yes,
To what is the choice of the audience, I think, because that probably tells you a lot about what can be financially sustainable. So it's very interesting. Thank you so much, Joanne. It's been such a pleasure to sit here with you today.
Thank you. It's a pleasure to be here.